tell us the role you played when COVID first broke at IMaH, and some of the things that you did to support the country's quest to contain the pandemic.
As an emergency physician, when COVID started breaking out, not even in Ghana, I anticipated that whatever we do, we'll get COVID coming through the emergency. So I prompted our CEO or the management of IMaH, and then with the help of GPHA management, we put in some strategies to set up a COVID ward and a COVID monitoring team, that is to start early testing. And luckily for us, GPHA they were very willing to get us the equipment we needed, and then the medication, some of them were not even in the country. They helped us procure those medications. So at the beginning, we've had good success rate with COVID because we started testing earlier. We had a policy. Once you are in the emergency, whether for COVID-related illnesses or not, we'll test you for COVID.
Yeah.
So we ended up getting the people who had COVID without symptoms, and treated them earlier before it got worse. That was where we got our reputation for having good success rates, because we screened everybody through the OPD and in the emergency for COVID. And I think it helped us catch COVID, I would say, in infancy before it went out of proportion.
So what would you say were some of the things that you did that culminated in the selection of IMaH as one of the referral centers in our country?
Ghana, we anticipated that if we had a lot of severe cases, we would be overwhelmed because we have limited ICU spaces. So one of the things that made IMaH stand out was we had improved and expanded on our critical care service for COVID patients. So we were one of the out of 4 hospitals in Ghana that was taking critical COVID cases. And I think it set IMaH apart.
Okay. So you caught the attention of the health authorities, and they singled you out as one of the referral centers.
For very severe cases.
Right. Great. And so how would you say your success rate was in terms of managing the pandemic and managing patients?
I would say our success rate was very high. We treated over 1,000 COVID patients, but only 500 were actually sick enough to be admitted. And out of the 500, our mortality has been less than 20, compared to other hospitals. Because we were very aggressive in our management. We didn't hold bars, so we went in guns blazing. So we had very good success rate. At some point, our success became a problem because we were overwhelmed with cases.
Because everybody wanted to refer there.
Yes, please.
Yes. All right. So tell me, did you have occasions where some of your staff, some of your colleagues, the paramedical staff, kind of like also got infected in the course of helping others?
I would say by the grace of God and following our infection prevention protocols, we've had only 2 staff get COVID from 2020 till now.
Wow.
So because you are treating COVID patients, you can see how sick they get. So everybody was extremely cautious, and management also enforced the hand washing, nose mask wearing among the staff and patients to the facility. So I think it reduced the infection rate among the health workers in IMaH.
Right. Walk us through the process.
Okay. From 2020 to now, our way of diagnosis has changed. Because in 2020, we were not testing. We didn't have the capability to test in IMaH. So we had to send our swabs to Noguchi, which would take sometimes 2 weeks. So we had to find a different way to diagnose COVID. Luckily for us, we had a very good radiological department with good CT scans. So with this chest CT, and in combination with some other labs, that could suggest it was COVID whilst we were waiting
for the actual results from Noguchi.
So we started treating. That also led to our success rate, because we didn't really wait for the results. PCR. So once you are tested, we had a COVID ward that was on the 2nd floor. We moved there, which was purely isolated. It was isolated from everything else. We didn't encourage visitors. We had guidelines on the number of people who could come see the COVID patient, just to prevent the spread to the household. But we didn't want, if a father is on admission for COVID, everybody in the house ends up having COVID. And so we would admit you to the COVID ward. Based on your labs and parameters, there were certain treatments we would give. And if we thought it was a severe case, would give you certain medications. They were quite expensive, but they were very good. Like, you would see improvement in symptoms in hours. It also improved our, the success rate, to a point that the pharmaceutical company that made that drug, anytime they imported it, they always called IMaH to make sure we needed it before they sold it to anywhere else.
Right.
Because they knew we were using it for good, and we were getting good rates from it, like good success rate from the. And we didn't even stop there. If you were tested and you didn't meet admission criteria, you were given a brochure on the things to look out for. That tells you that your symptoms were changing.
Right.
What to do and what not to do. With a dedicated telephone number to call regarding anything of concern to with your COVID treatment. And even after discharge, those who were admitted, they all had my contact number. I would tell you, call me even if it's the middle of the night. Because I'd prefer you wake me up from sleep than to not call me and then something we had managed for days and you got better becomes worse. So we had hotlines for people who were discharged to call in when they had concerns, or even concerns for other relatives in the house. So it was more like a community treatment of COVID. We didn't just treat you and left you to your own and leave you to your own. Whether you were treated through the OPD, outpatient department, or you were on admission and discharge, we followed up on it. And when they started rolling out the vaccine, I made it a personal goal to call each and every patient that was ever admitted,
Right.
to ask them to come to IMaH for the
On
vaccine.
vaccination.